Health and Conflicts project is led by the King's College London, and we are working with them as a team from Hacettepe University in Ankara, Turkey. So I involved in this project basically from my area, the cancer. So we have been focusing on the palliative care and cancer control and the situation of the cancer in the refugee population. That was the main work stream for that project we are leading in Turkey. I'm coordinating the team in Turkey, working with the King's College team. But the other work stream are when mental health is an issue, because we have a population of refugee population of at least 4 million refugee population, mainly from Syria, but we also have other refugee population. So we have a team focusing on the mental health in the refugee, basically refugee population. But we also had another work stream, health in conflicts. Those are the major fields from our side as Hacettepe University, Ankara, Turkey, to contribute to King's College work. I think that was a good idea. To see the research capacity in the Lebanon, Palestine, Jordan and Turkey. This project is basically investing on the research capacity. How you can increase the research capacity? There are two ways of it. First is by doing research, you can increase the research capacity. The other one is the educational meetings, workshops, and involving young people, getting young people from your place to these kinds of projects. These are the main things we are doing with the team in King's College London. It's just started recently. We had a startup meeting, just about a month ago, but we will have the next executive board meeting in Ankara, Turkey. We established a team, a mental health team, a palliative care research team, and health in conflicts team already started to work. So we are doing a systematic review on the palliative care, but we will also conduct a prospective study on the palliative care in children with cancer. What is the need? What percentage of the patients in our institution really needs the palliative care? Palliative care is relatively new, not only in Turkey, but in most parts of the world. This is why we are trying to invest on palliative care, because most of the time, most of the clinicians and most of the institutions are heavily overloaded with the routine care. So they don't have that much time or fund or space or whatever you name for resources to invest in the palliative care. If we can get results from this palliative care need assessment study, then we will go back and ask all stakeholders. This is the situation of the palliative care in the pediatric setting. This is the situation of the palliative care in the other oncological setting. So how can we work together and increase our research capacity to make changes happen in this field? The team is at Hacettepe, but we are open to work with any organizations. As a good example of it, for example, we have our biannual National Cancer Meeting in April 2019. Right before that, we are organizing a course, Cancer Control for Oncology Professionals. Most of the time, what happens with the cancer control programs, the people in ministry invite all stakeholders, they sit and work together. This is good. I appreciate this, but also important, another important thing is to attract other oncology professionals. As I said earlier, oncology professionals are heavily overloaded with their routine work. they have to know the onco-policy. So this is why we aim to organize a cancer control course for oncology professionals. It's a joint effort, Hacettepe University, my team at Hacettepe, Ankara, Turkey, and the King's College team. That's a one-day course. Then based on the success of that course, the next step is invite all stakeholders and work in more details in cancer control, maybe a workshop or something like that, 5 days program. So how can we make progress on cancer control? Turkey has a cancer control program started in 2008, revised in 2013. But we also need a new revision now, I believe, because cancer in the global landscape has changed a lot. The priority has changed. United Nations level, WHO level, cancer is getting more and more on the agenda. On the other side, we can say in some areas there is so much progress, but in some areas we still need to focus. This is how we think on cancer control at the national level. I was a happy oncologist with what I was doing. I was seeing my patients every day. I felt so good because I was helping the families who have children with cancer. But when I realized that in 1 year, how many patients I can treat? 50, 70, 100? I believe it was early 2000. I believe I can contribute more. So I look around. There was no pediatric cancer registry. How many patients in the country? How is the survival rate? How we are doing? How do we measure our success? Then I went to the National Pediatric Oncology Society, and I went to National Pediatric Hematology Society. Honestly, I didn't have any money at that time. With zero money, I went to the society. Okay, in Turkey we are expecting 3,000 pediatric cancer patients in a year. So registering the pediatric cancer patients is much easier than the adult patients because we are expecting 175,000 adult cases. So it's of course it's a serious work, but it shouldn't be so difficult. It took some time to convince my colleague, but I was successful, and we started our registry in 2002. Now here in this World Cancer Congress in 2008 in Malaysia, Kuala Lumpur, I am presenting the second step of the pediatric cancer registry from Turkey. The data from 2009 up to now, 2017. So I'm presenting the results from the 15,000 pediatric cancer patients. Actually, the distribution of the pediatric cancer based on this registry is not so much different from the other Western countries. There's only one difference. We see more lymphoma than CNS tumors. Regularly, or usually you see leukemia, central nervous system tumors, and the lymphomas. But in my country, lymphoma are more than CNS tumors. There could be some underreporting of central nervous system tumor. That could be a reason. But whatever the reason is, we knew that, we learned from this experience, we have a little bit higher incidence of lymphoma than the Western countries, although it is not as high as it is in North Africa or some other Middle East countries. But to me, the greatest benefit of this survival, this registry is for the first time at the national level, we were able to measure the survival rate of childhood cancer in Turkey. At the moment, based on this study, the survival rate is 67%. This is the result, how we are doing at the national level. When you look at the high-income countries, the expected survival rate for the pediatric cancer is around 80%. When you go to low-income countries, the survival rate is about, let's say, 25%. Turkey is a upper middle-income country. So now I would say 67% survival rate is quite compatible with our development index. This is compatible. That means we are doing good. But lessons learned from this experience. How can we increase our survival rate 5% in next 5 years? This is the main outcome of this study. When I am talking to my colleagues at the nation level, anytime, okay, this is the survival rate, but we have to invest. How can we make changes happen to have a better survival rate, although we are doing good? Because the model I'm using, I haven't spent any money on this project. Just going and talking with my colleagues from different centers. As a middle-income country, you may not find enough funds to do such a study. If they have secretary, if they have young fellows, if they have some faculty members, I mean, the number of when you're looking the number of the pediatric cancers, they can register. And this is this is a model. Don't wait to get some support from somebody else. It is you to do research. It is your country. It is your contribution. You can do something for your patients.